This is Dr. Rajput. We are going to talk about GERD, which is known as heartburn. GERD stands for G-E-R-D. G for gastric, means stomach. E for esophagus, food pipe. And R for reflux, which is the backup of the acid and intestinal juices from the stomach to the esophagus. It is very common, and 33% of the people have off and on type of this heartburn, and 10% of the people have almost every day. The heartburn is so severe sometimes that they feel that they are having a heart attack. The chronic condition can cause a lot of symptoms, especially the hoarseness of the voice, breath, taking difficulty, also the sleeping problem, asthma problem, and the cause of the acid going back into the esophagus is because of the weakening of the muscle at the end of the esophagus called LES muscle, which is also known as the lower esophageal sphincter, and it loses its pressure, and that's why the acid can go back from the stomach to the esophagus and erodes the esophagus lining. And sometimes the complications can be very severe, and they can be ulcers, stricture, adenocarcinoma, and Barrett's esophagus. Now, what are the risk factors? Well, the risk factors are easy to identify, especially eating fatty foods, chocolate, mint, drinking alcohol, smoking, and medication. They all decrease the lower esophageal sphincter pressure. You should have a good look at your prescribed medications to find out the culprit. The medications can be calcium channel blockers, especially nifedipine, verapamil, diltiazem, and sedatives like Valium, Librium, Ativan, Xanax, etc. Anticholinergics, especially atropine, benzotropine, ipratropium, oxybutynin, dextromethorphan, and many others. Some narcotics as opioid pain relievers like codeine, fentanyl, meperidine, morphine, oxycodone, cocaine, heroin, etc. They all decrease the lower esophageal sphincter tone and pressure. Then obesity also increases the intra-abdominal pressure and causes the GERD or reflux or heartburn. Hiatal hernia changes the esophageal and stomach junction, also causes GERD. Now, how it is diagnosed? There are 5 ways to diagnose GERD. Number 1 is the EGD, which is esophageal gastroduodenoscopy, which is also known as endoscopic examination. It is done by the gastroenterologist who is expert in GI, especially gastrointestinal diseases, and the scope is a tube that passes through your esophagus and stomach, and it is the layers are seen and the biopsy is taken. The second is barium swallow test, in which the barium liquid is swallowed by the patient and the observation is done on the screen to see how are the movement or peristalsis and also any anatomical abnormality in the esophagus. The next is the Bernstein test, which is also known as acid perfusion test. In this test, 0.1 N-hydrochloric acid is introduced into the mid-esophagus through a tube. If it causes burn twice after infusion and it's relieved by sodium chloride, then it is known definitely that the person has GERD. There is a pH monitoring done, which is a gold standard test for GERD, and it is done for 24 hours. A thin tube with acid sensor tip is inserted through the stomach, and it is placed above the sphincter, and the other end of the tube is hooked up with a recorder with buttons, and for 24 hours you maintain a diary of your normal usual daily activities like sitting, walking, standing, doing exercise, sleeping, taking nap, all these things being recorded, and at the time of heartburn you note what activity you are doing and what time this happens. Next is the manometry. This test is to measure the peristalsis and opening of the sphincter muscle and relaxation. In theory, this test is good, but the peristalsis and the opening of the sphincter open transiently and is less used. Now, what should be the treatment for GERD? Well, there is lifestyle modification, number one, and number two is the drug therapy, and third is the surgery. In the lifestyle modification, the person has to lose weight, they have to maintain their ideal body weight, they have to quit smoking, drinking, and alcohol use, and they have to eat in small protein meals at different times. They should not have a heavy meal at the supper time. There should be a time difference between supper meal as well as the sleep, and a person should not sleep right after the supper. And the drug, before the drug therapy, also a person has to elevate the head along with the chest about 30 degrees, and in that way the reflex would have difficulty, or acid has a difficulty to go up. Now, what are the drug therapies? The drug therapies are antacids, H2 blockers, PPI, and the antacids are frequently used. They are over the counter, everybody uses them, and they are the temporary fix, but they are not the permanent relief. They are like Gaviscon, milk of magnesia, Mylanta, Riopan, and Maalox, Alka-Seltzer, Tums. They are, as mentioned, over the counter, but should not be used for a longer period of time. They all contain aluminum and magnesium, and especially in the pregnancy period as well as the kidney problem, a person should be aware of taking their adverse effect. Now, H2 blockers. H2 means the histamine receptor 2, and this histamine is a chemical which is produced by enterochromaffin like cells, and they are in the lining of the stomach, and they help the parietal cell to produce the acid. When the H2 receptors are blocked, then the parietal cells are not stimulated and the acid is not produced. And these are like cimetidine, Tagamet, ranitidine, Zantac, famotidine, Pepsid, nizatidine, Axid, and they cause usually dizziness, diarrhea, headache, and tiredness. They are good for GERD. The person with pregnancy should be careful, and they have a drug interaction with phenytoin, warfarin, and theophylline. There was a motility drug called Reglan or metachlorobromide was used, but it has been discontinued because of its very severe adverse effect, especially the jerking movement of the muscles and stiffness, depression, agitation, and sometimes difficulty in breathing. Now, proton pump inhibitors is the new kid on the block, and they do wonderful things about this acid reflux, and they are called proton pump inhibitor because they work on the PT proton pump on ATPase pump, and therefore the acid is not produced. And their examples are omeprazole, which is Prilosec, lansoprazole, which is Prevacid, and rabiprazole, which is Acifex, and pantoprazole, which is Protonix, and Dexta and Dexilant. These are used for GERD for 12 weeks, and sometimes it can be repeated, but they should not be taken for a longer period of time. Just please remember, don't use it indefinitely because it can cause problems, and especially the lymphoma and the difficile colitis, bone fracture, and recently some cardiac problems. The 25% of the people do not respond to antacid, H2 blocker, proton pump inhibitor, even after the repeated course. They have the symptoms and they go for surgery, which is called Nissen fundoplication. This surgery, Nissen surgery, is nowadays done by laparoscopic means, in which there is no open operation of the abdomen and there is no big scar. Only the scope is inserted through the holes, and the upper portion of the stomach is rotated at 360 degree and sutured. The idea is that when the stomach contracts, and so does the esophagus, and the acid does not go into the esophagus and cause GERD. Therefore, this surgery relieves the pain and has a significant role in the treatment of GERD. This was all about GERD. I hope you like it, and please, for more information, see drrajput.com, doctorrajput.com, and look for Dr. Rajput for your health. And also, please look for our other series, and we are very hopeful that you would have 1 or 2 points to use in your life. Thank you so much again for your time, and we'll see you again.